Hello, everyone, and thank you for inviting me. So, in looking at the schedule and in listening to this last presentation, I hope everybody's ready for sort of a change of pace, because we won't be talking about any numbers, but we will be talking about ways to do a different kind of vigorous research. And I'm happy to take some questions during this, but I have to say probably not a lot of questions, only because I was asked to do kind of a soup to nuts presentation in an hour. And so I'll try to move through, and you'll notice that I'm not able to give a lot of detail on any particular type of method, but I hope that what I can do is give you enough detail and enough of kind of an awareness raising of what kind of qualitative methods are commonly used in clinical research and public health research, and how you might use them in your research. So my objectives are basically to give you that kind of overview, and I'll also be giving small examples as we go along, and finishing up at the end with a few examples of studies that I've done that show you how I've integrated the different kinds of methods. So the first thing to really think about is why conduct qualitative research? Years ago, when I first started working with physicians and with public health professionals, qualitative research was very, very strange to people. It wasn't used. The idea was to maybe throw in one focus group, and I'll talk a little bit later about focus groups, but it was very unknown. And now you've probably noticed that even if it's not your primary type of research method that you want to use, or that the researchers you're involved with want to use, you'll notice that people are more and more actually involving qualitative research at different stages. It really can be a terrific addition, because what you get from qualitative research is meaning and context about the topic that you're looking at in a way that's very, very different than you can get from other methods. And that's really what I want to talk about today. You know, I'm not ever going to say that qualitative research is better than quantitative or vice versa. It's different ways of knowing. You get different kinds of data, and when you put them together, you have a very, very strong project. So one important qualitative anthropologist, James Spradley, said a long time ago, "I want to understand the world from your point of view. I want to know what you know in the way that you know it. I want to understand the meaning of your experience, to walk in your shoes, to feel things as you feel them, to explain things as you explain them. Will you become my teacher and help me understand?" And basically, that's what qualitative researchers are saying to the participants in their studies, that we want to know what you're thinking and you're doing from your perspective. So the nature of qualitative research is very different from quantitative research. And all through the years that I've been collaborating people, a nasty rumor keeps popping up, and that is that qualitative and quantitative methods are so antithetical to each other that they cannot be used together, or they cannot be used in the same research design. And I hope that by the end of today, or today's talk, you might realize, well, you know, maybe that was just a rumor after all. And done well, it can be very, very helpful to put the things together. What you do is, in qualitative research, it attempts to make sense of the social world in terms of the meanings people bring to it. So when I say social world, it can be as broad or as narrow as makes sense for your study. So it could be what is going on in this particular ICU, what's going on in this broader immigrant community, what's happening in all of Boston in relation to a particular topic. Whatever it is that your research study is about, that's what your social world is. And the interactions of people that are going on within there is what you're looking at with qualitative research. So you wanted to uncover ideas, insight, and ways of thinking about phenomena of which there's little is known. So before you do any kind of quantitative research, you might want to do some qualitative in order to understand what the concepts are from the perspective of the people who will be in your study. Also, you can get a new way of looking and getting a different perspective on something that quite a bit is known, but maybe not from every perspective that's out there. And again, you can contextualize your understanding of an issue. And that word, I'm going to keep coming back to it, because that's what I think qualitative research is so good at, is giving you the social context of what you're looking at. So a Howard Stein, who is a medical anthropologist in a family medicine department in Oklahoma, said, "We are all natives, insiders to some groups and outsiders to others, even as we aspire also to be scientists and transcend the tribal." And what he's saying is actually very, very important to probably most people in this room, because historically, when anthropologists did qualitative research, we went far away, we went to places we were unfamiliar with, and we brought our own ways of thinking to places that were very strange to us. But many people who are doing health research might be studying phenomenon in the same hospital in which they're employed. So in some ways you're wearing different hats and you bring your own thinking, you bring your own tribal way of thinking, but you have to transcend that in order to also look at what's going on with people who think differently about the same environment that I'm in every day. And if you don't do that, then you're sort of not really doing the research because you're just thinking your own thoughts. So wearing those double hats is important to think about who are you within the whole thing. So there's different ways of looking at it. In anthropology, we have this concept, this kind of dichotomous concept of emic and etic. It comes from linguistics, but it's very, very useful in thinking about whose perspective are you collecting the data from. So emic is really considering the insider's perspective. So if you interview a person about something and she tells you what her thoughts are about that, that's her emic perspective. If you watch her doing something, but nobody's explaining it to you, and you're using your own scientific concepts that come from theory or what you know from the literature or any other areas that you might have collected ways of thinking about something, that's the etic. So let me give you an example. So you're interviewing your patients about what they think about taking an anticoagulant, for instance, including such topics as reasons they think they're prescribed the medication, how they think the medication works, whether they think they should take it, what they think would happen if they don't take it, or if they take it differently than you've prescribed it, what labels they use to refer to the medication and what it does to them, how much they should take, how they know how much they should take, when they should take it, what dietary considerations they think they might need to make while they're taking it, and not the same thing, what dietary habits they say that they are actually practicing, why they think they're told to have INR testing, what the INR tests really mean to them. And you can see I could go on and on and on and on in this topic, but all of these questions get at what that patient is thinking. So sometimes it's considered subjective because it's not an outside observer, it's a subjective thoughts of those patients. So in contrast, you could look at the etic, outsider's perspective, and in this case, on the same topic, you would ask questions. You would be you wouldn't ask questions, you would be observing the patient's behavior. If, let's say, somehow you could put yourself in a position to observe the patient's medicine-taking behaviors, and you would document what they do in terms of how much they take, when they take it, how they in reality manage their diet, which could be very, very different from what they told you they're eating, how adherent they are to the INR testing, what the results of the tests are. All of these, maybe might seem to be more objective results. And so then what you do is you interpret what's going on with the patient from what you think you know about what you see. So the way I'm wording this, you might be able to see that there could be some problems inherent in both. Like, how do you know which is reality? How do you know which is true? Your qualitative data is only as good in some ways as the data that people give you. But on the other hand, what you look at is only as real as how you interpret what you see people are doing. So often when you watch people do things, you might want to know, why are they doing that? How often do they do that? What was she thinking when she decided this was the way to take the medicine? You can't tell that from observing, but if you only asked her, you don't really know what she's doing. So that's why triangulation of research methods is so important. And when you've heard the concept of mixed method studies, actually qualitative research has historically been mixed method because one method alone only gets you so far. You need different ways of knowing and putting them together. So these days people put together qualitative methods and then they also put together qualitative methods with quantitative methods. And that's where the power is putting all those methods together. So I won't go very much into this because your next lecture will be about community-based participatory research. But one of the things that's so important for qualitative research is that if you're doing population-based research or community-based research, that you are involved in the community and the community is involved in what you're doing, which also was something that was very, very unusual when I first came into public health research in the early 90s, and now is pretty common, but it's easy to forget a lot of the steps. So I won't go into the details, but these are sort of the overall guidelines that I like people to think about. And when I say get involved in the community, all aspects of project management should be out in the community for people to see who's involved and involve people early on. I will say I remember very early in the 90s going to a kind of regional conference about health disparities, in fact, in Boston, and somebody stood up from one of the Latino health institutes and said, the thing that's really upsetting to me is that the Latino community is brought into the research only at the stage where recruitment is necessary. Can you get me enough people for 5 focus groups? And it was insulting. It was insulting, and it also was detrimental to the research. Now people have gone a lot further than that, and people are much more cognizant of the need to involve community at early aspects, but also it's not easy to do. You need to plan for it and have time for it and spend time in the community and do it well. So if you do, though, the study will be more relevant to community needs, more feasible due to community buy-in and community acceptance of what you're doing, and also the fact that community will have had input, so it makes more sense. And still more likely to achieve the desired sample because you probably get a lot of help with recruitment, and more ethical because the questions and the priorities and the recruitment methods and the data collection and all the way through to the analysis and the presentation will be much more respectful. So, so I needed to put that plug in, even though I'm not giving an entire talk on that topic. So qualitative research approach. Sometimes what people try to do is use qualitative methods, but retain a quantitative approach to their thinking about research and their design of research and their design of samples. So you don't want to do that. You want to think about what is different about qualitative research and what is necessary to do really good, rigorous qualitative research. And so what you can find out in qualitative research is the range of phenomena in the sample studied. You're not going to get representation, you're not going to get p-values, you're not going to use random samples. You are going to do what makes sense for qualitative research. And so often, I can't tell you how often, the first review of fully qualitative papers that I submit come back saying, I bet you have numbers. I know you have numbers. I can sense you have numbers. Why didn't you report the numbers? And I actually have developed a pretty successful paragraph that I send back to the reviewer saying, you know, that I respectfully actually refuse to provide you with numbers because it doesn't make any sense to provide numbers because it's not representative. You know, I learned early on in my collaborations with epidemiologists that numbers on a small sample are not valid. It doesn't make sense, so don't do it. So don't let anybody talk you into providing numbers for your small sample qualitative research. What you can tell people is a really rich story about the meaning and the context and the whys and the hows of what's going on regarding the phenomenon under study. And so that's what you want to do. You don't want to apologize for not being able to do what quantitative research can do. You want to showcase what you have done with qualitative research, which gives another perspective on the phenomenon that maybe you've also researched from a quantitative perspective. You can put them together in a mixed method study. So what you use is what we call purposive stratified samples, because you want your samples to be really, really good. A random sample, I also learned from my epidemiologist colleagues, of that is small is not necessarily going to be representative. So what's the point of doing it? But what you want is you want people who will talk to you about the issue under study and who demonstrate the diversity of the population that you're looking at. So I did a study of Dominicans and Puerto Ricans in Providence around cancer prevention attitudes and beliefs. And it was 146 two-hour home-based qualitative interviews. So instead of doing that, was a pretty large sample, and maybe, I don't know, I could have gotten away with a random sample of that. But what I wanted was, I wanted people who had health insurance and people who didn't, people who were younger and people who were older, people who still live with children and people who didn't, people who were new immigrants and people who weren't, and on and on and on. So I had a stratified sample, and I had a big chart that we were constantly filling in as we did the recruitment to make sure that I was hearing from people who had the characteristics that illustrated all the different kinds of situations that Latinos or Dominicans and Puerto Ricans in Providence had. And so you can see that a random sample wouldn't necessarily have gotten me that. But this was a very, very strong, very, very clearly sought sample, but it wasn't random. So you describe it as what it is, as opposed to apologizing that it's not random because you didn't want a random sample. And then, as I said, it's generally multi-method. And the important thing is that people often say to me, what are the best methods to use? And then my first question is, well, what's your research question? Because it's just like with any kind of study you're doing, the research question determines your choice of methods. And it always does. Yeah?
A quick question. Whenever you have not random, to me it sounds like possible bias. How do you get around that?
Well, bias is a big issue. I have to put to you the potential of bias occurring in quantitative research as well. So I think the idea of discussing bias only in qualitative research is an erroneous approach in research. So if you'll be willing to go forth from here and consider bias in quantitative research for the rest of your career also, then I think that we can talk about bias in qualitative research. What you do is, and I think it's something that I can't go into today in detail because we could have lectures and lectures on the issue of looking for validity and rigor and credibility and all the kinds of quality indicators that you're looking for in research. They're not identical. Some will say that they are identical as quantitative research, and some will say they're not. And I think I gave you 2 articles to read that cover 2 different approaches to looking at how you get at quality. But in this case, bias can happen when your sample is very small and you don't know how you're recruiting. So, for instance, I did a study of overweight in Black women in Boston in the early 90s, and we did a lot of focus groups. We did 30 focus groups, and we used community recruiters, people in the community to help us recruit. So what we ended up with was bias in every single focus group, but we did a lot of focus groups. So when we had somebody who belonged to a Pentecostal church do the recruiting, the focus group ended up in that Pentecostal church with members of that Pentecostal church. So that's an extraordinarily biased focus group. But had we not had a recruiter from that community, we probably wouldn't have had any participants from that community. So the fact that we had that focus group, if that had been our only focus group or one of 2 or 3 focus groups, it would have been a horribly biased sample. But that was one of 32. Then we had a focus group that was recruited by somebody who had started a walking group, who was overweight and started a walking group. So most of the women in that focus group were, everyone in the focus groups had to be overweight, but most of the women in that focus group were really motivated to lose some weight, really biased sample. But that was the second one of 32. Then we had a focus group where it turned out that women were telling me that they had gained a lot of weight, and about 6 or 8 months ago, they decided it was time to start losing weight. And after a few minutes, I finally asked, why? Why is everybody, what happened 6 or 8 months ago? What happened 6 or 8 months ago is most of those women had gotten out of jail. So the recruiter had been in jail, and she met most of these women within that community. We never would have had anybody in our focus groups had I done the recruiting. And if we had only had that focus group, imagine the bias and stereotypes. So what you do is, we knew that we wanted to interview people from all walks of life, all educational backgrounds, all economic backgrounds, and we went to places and repeatedly interviewed. And what you do is you do this until you get what's called data saturation. And when you start hearing the same thing over and over and over again, then you realize, it seems like we've pretty much covered the range of possibility here. So there is bias, but you have to acknowledge the bias. You have to be extraordinarily aware, A, of your own biases. And there are some journals now, like the Annals of Family Medicine, where you must have a paragraph in the beginning of your method saying, who are you? So when I published a cholesterol study, we had one doctor who was American and Israeli and didn't really believe in cholesterol testing that much, and we had another doctor who was gung-ho on cholesterol testing, and we had me, who was the anthropologist who didn't have an opinion on cholesterol testing, and you have to do that. So I would say that it's there, but it's everywhere. The difference is we're called to task on a continuous basis in qualitative research to make it transparent, and I think it's a good thing. So I'm glad you asked that question.
When you get a lot of different bias groups, you essentially are randomizing in totality in the end. When you look at the whole, spectrum of your results, you pretty much, sounds like you approach the randomization in a way.
In a way, I wouldn't dare call it randomization, but
well, not exactly,
but it, yeah.
I was just going to simply supplement what you just said about qualitative research on the other end of quantitative research. We forget that quantitative research, the investigator, just like qualitative research, defines the question. And who you are, and how you define that question can be totally biased. So if you look at editorial boards of medical journals, for example, many individuals will be selected from the basic science or sort of clinical randomized clinical trial perspective. So that's the perspective. So the things that are going to get published in certain journals are going to be simply looking at those sort of methodology. I mean, that's bias, although it's quantitative.
Yeah.
I'd like to make a brief comment from a statistical perspective on this issue of bias, that actually the way you're using bias is a quantitative concept. You're thinking that there's a population characteristic and you're trying to estimate it, and there's a numerical bias. So I would describe the distinction here is that Dr. Goldman is talking about characterizing the population in a holistic way. She wants to understand the range of views, the different perspectives, and it's not so much what is the average perspective or what's the typical perspective as really characterizing the community holistically. So, of course, bias has other meanings, but I think when we're using the term right here, we're talking about a systematic error in estimating some attribute of the population. And I would submit that actually, as you said at the beginning, that's not really relevant to what you're trying to accomplish in this work, the sort of quantitative meaning of bias. What's your reaction to that?
Yeah, no, I totally agree. And you can see, going back to my earlier example, that if we just try to purely randomly select for these focus groups, I probably wouldn't have gotten any of the people that I mentioned were in these focus groups that I described to you, because we wouldn't have accessed them. There's just no way we probably would have run into them. So yeah, so that was a great way to, glad we have that on tape. It's a good way to describe that. So, okay, so good. What I'd like to do now is start going through some of the really typical methods in qualitative research that I think could be very, very useful in conjunction with quantitative methods, or various on their own in, as a formative study. So these are the ones that I'll go through, these various methods and briefly. But the main thing that I also want to say is that all of these methods, no matter what method you use, just like in any kind of research, you will want to use these methods in conjunction with, preferably following, a broad literature review. And the reason I put that in there, because another rumor I'm constantly hearing is that qualitative research must be done with as blank a slate as possible. We can't know very much about what we're doing before we start the qualitative research, or we will, and then there's the word again, bias it. And I don't come from that perspective. So I think where this came from is several decades ago, there was one kind of newly formatted type of qualitative research called grounded theory that you might have heard of. And the people who are grounded theorists sort of have this idea that they're coming from the ground up and that they are going to look at the data for what the data is, and they won't use any kind of overarching theory, and they won't try to put any overlaying framework on what they're doing. I don't know whether it's entirely possible for human beings to do that, because we all do have our own ways of looking at things based on everything that we know up to date. But what I would say is, for qualitative research, you want to know what's been done already. You want to know what people have already found in the communities and with the populations that you're studying, on the topics that you're studying, and you want to take it from there. You don't want to always reinvent the wheel. So yes, please do a literature search before you do your qualitative work, and don't feel bad about it.
Can we use PubMed, or are there others like InfoBetter, or are there?
Well, it depends. Again, it depends on what your research topic is. So, interestingly, all the papers that I've written are indexed in PubMed, because it goes from, the research could go in an oncology journal, or it could go in, patient education and counseling. Like, it all depends on what it is. So, but if you, for instance, are new to an area, and let's say you want to look at substance use, a study that I actually did a community-based participatory research study that the Latino community in Providence asked me to do with them, was about substance use and risk for substance use in the Latino youth community. So let's say you were going to do that, and you had never you don't know what's going on in Providence, and you had never studied Latinos before, and you don't really know much about youth behaviors. So what you might want to do is use PubMed, use PsycInfo, and then go into like sociological abstracts and find some ethnographic studies. And when I say broad, I really mean broad. I think it's a great idea, especially for people who are going to be studying populations that they are unfamiliar with. Look at the ethnographic literature. Find out what people already know about a particular community or a particular ethnic community, even if they're not living exactly where just read really, really broadly to find out, because I do believe in this notion of different ways of knowing. And you will get very interesting articles in PubMed, but chances are the slant, as you said, the slant is going to be on the medicine part and not so much on the people part. And it could be very, very helpful for you to go into a community knowing something about immigration patterns, about cultural beliefs, or, it could go anywhere depending on your topic. So again, just like with anything else, it's your research question that's going to drive what you do and how you do it. So, starting with participant observation. What is it? It is observation. It's observation, but it's not just hanging around. Sometimes it looks like just hanging around. One of the first research I did was in a highland village in Peru, and it really looked like I was just hanging around. And the population thought I was the laziest, richest person they had ever met, because how is it that I just have the leisure to sit around in the town plaza? I was actually looking at reconstruction after an earthquake, so it was relevant. But people couldn't understand, and they knew that I was a student, but it was just, so even though it looked like I was just hanging around, if somebody had done participant observation to watch what I was doing, they would have seen that I was in that plaza morning, afternoon, and evening, different days of the week, on the weekend, sometimes with other people, sometimes alone. Always different, but always structured. I knew what I was doing. I knew that I needed to view what I was looking at, which was basically, at that particular moment, how people were using the new plaza, but I needed to look at it at all different times of day. So if you are interested in how patients and their family interact on an inpatient hospice unit, you don't want to just go at 10 o'clock on a Tuesday morning, because it's going to be very, very different interactions on a Tuesday morning, then on a Tuesday afternoon, then in the evening, then on a Saturday, then on a Sunday morning. So you need to go at all different times, and you need to map that out for yourself. So it's structured and it's rigorous, even if it looks pretty darn informal. The other thing that happens during participant observation is you do a lot of reflection on what you're seeing, note writing afterwards, and you make questions for yourself, and then you go back and look again. It can range from high to no participation at all. So when I did do participation on an inpatient hospice unit, clearly it was the low end. I had absolutely no participation. I was just hanging around and informally talking to the family members in the common rooms. But sometimes you might find there are people who are interested in what is, the toxin exposure or the carpal tunnel risk of working in a particular kind of factory. And I've known people who have actually gotten jobs in these factories and work there. So that's high participation, obviously. So, and then there's everything in between. So to study what's going on in a unit, well, let's say I was a nurse in that unit and I was also getting a master's in public health, I might be doing my master's thesis on what's going on in that unit. So it's very high participation, very, very, very heavy risk for bias, because I have my own way of thinking about what's going on in there. And I teach a course in qualitative methods here at the School of Public Health. And often my students are physicians who are doing studies in their own locations. And so we talk a lot about that, about recognizing that bias. But so you need to figure out what's going on in that range. And actually, if you are suddenly becoming a researcher in an environment where you've been a clinician, you need to let people know that you're wearing a different hat. They shouldn't be interacting with you as a clinician if you are a researcher, and they don't know that. So that's a whole other thing. But the idea is that you are watching what's going on, and you are really, 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 really seeing what's going on. Because how many people have gone to a place and spent some time there, and then somebody that you're with has said, wow, did you see that really interesting chair that was in the corner? People seem to be afraid to sit on it. And you might say, oh, no, I didn't notice the chair. Or you might have noticed the chair, but it didn't occur to you one way or another that people seem to be sitting on it or not sitting on it or perching on it or whatever. And you might be thinking right now, who cares? But let's say, transfer that into some kind of health topic that you're thinking of. What I'm pointing out is that we go through life all the time, and there are dozens and dozens of things that we don't see unless we put our mind to it. So what you want to do is really put your mind to it. You want to decide, what are you going to be looking at, and really look at it, and also be open to seeing new things, because you don't want to get so boxed in. Like some people like to just go in with a notepad or just kind of remember things and write it later, but other people like to go in with a template. And especially if you have a project where you have participant observers sort of going all over the place, you might want them all to be looking at similar things. So you might create an observation template for them. But you also want to remind yourself and your observers that what else is going on. You want to see things you didn't expect. Otherwise, it might not even be worth doing the observation because you might just be documenting what you already know is going on. So the idea is that you can use participant observation at different times because you do some interviews, people tell you things, and they tell you, oh yeah, when I'm doing this particular task on the construction site, it's too uncomfortable to wear goggles, so I don't. And you don't really know that much about construction sites, but you're doing a study of safety risks on construction sites, and so you're listening to this person. You don't even really know how to probe. You don't know how to really ask the questions because you're not really sure what he's talking about. You do some participant observation. You see it in action. You are much better equipped to ask your questions. Or you're on the construction site, and this was another study that we did here at the School of Public Health, this exact study, and you're on the construction site, and you see people doing things, and you see sometimes they're wearing goggles and sometimes they're not wearing goggles for the same activity, or there's different activities which look equally as dangerous to you and the sparks are flying, and you can't figure out why they are wearing goggles sometimes and not wearing goggles other times. So then you might do some informal interviewing during that participant observation, but you might also work those questions in. You'd be able to get more credibility with your interviewees when you say, the last time I was on a site, I noticed that when they were doing this, they were wearing goggles, and when they were doing this, they weren't. What do you think about that? What was going on? And then they can explain that to you, and you can find out what their behavior is. So often, qualitative research is iterative, where you do one thing, then you do another thing, then you go back again, then you move a little bit forwards, and then maybe you go sideways, and then you move a little bit forwards. You're kind of moving towards the same goal of finding something out that you put forth in your proposal, but your route to get there might be a little bit variable. So I'm worried that clock is not working.
The red clock tells you how much remains.
Oh, okay, yeah, so good. All right. So we went through this in terms of really seeing what you kind of expect to see and what you don't. And interviews. There are basically 4 different structures of interviews, and the one in red, semi-structured interviewing, is the one that we use most often in health research. I don't really recommend using informal interviews except during participant observation, when it's unplanned and you don't really have a script and you just ask something kind of spontaneously, works very well there. Unstructured, planned interviews, I think, are kind of silly, because if you're planning an interview, plan what you want to know, especially if you have more than one person interviewing. Then you want to have a core set of questions that everybody asks everybody, and you use spontaneous probes to clarify what the person's saying and also to follow new avenues of inquiry that the person brings up. So that's what we call semi-structured interviewing, and that's the one that you use more often than not. And structured interviewing is where the question list is fixed. It may be open-ended questions, but you always ask them in the same order, and you always only ask those, and I don't know why you'd want to limit yourself. So usually you don't use that either. It's the semi-structure that really gets you the rich information that allows you to realize that you're getting to saturation. Because if you don't allow people to bring in new ideas, then you don't really know whether there are things that you're missing. So you want to structure it in a way that you're flexible enough to follow those avenues. And it's okay to reorganize. And it's okay also to revise. You do a few interviews and some of the questions aren't working out, change them. You can do that. You just modify them to get the information, to get people talking on the topics that you need. Also, often after the first few interviews, I don't even use the script. I know the interview script so well that I let the person tell me the story, and then I probe to get them to fill in the pieces that are missing. So it doesn't matter if it's not done in the same order, and you want to do it in a way that really, really gets them talking and comfortable. So I used to think that qualitative interviewing can only be done in person, and actually I've done quite a number of studies in the last number of years where, for one reason or another, it had to be by telephone. For instance, I was doing a study with people who had hematologic cancers, and they came to Dana-Farber and then to other tertiary care hospitals from all over the country. So it was impossible to do the interviews in person because we were doing them 2 weeks after a second opinion consult. And it worked out really, really well. And if you get a good pace going and get very good at doing these qualitative interviews, sometimes it's good to do it on the phone, especially with people who are very sick. I could do it on their own time. They were in their own house. They could take a break and tell me to call them back in 5 minutes. It worked very, very well. So, and then even I did shorter interviews with more local people, but it was more convenient for the people to do it that way. So you can do it that way now. I never tried it, but with video, Skype, and all the new modalities that we have out there, the opportunities are just growing. Written qualitative interviews I don't think are all that useful because people don't generally like to be asked to write a lot, and it would only work for very literate people, very motivated people. But whatever the modality, there'll be open-ended questions. So open-ended questions, they're hard to write, and people often start with closed-ended questions. And so what I tell my students and the residents that I work with in family medicine is just blitz out your questions and then look at them again. So at least you know what you want to find out about, and then you tinker with them and you make them more open-ended. Yeah.
Just a quick question. Are these interviews and questions, do they have to be approved by an IRB? In which case, can you change them as you go along? Or?
Well, it's up to your IRB. You know, some years the IRBs that I've worked with have wanted to see exactly how the question was worded. And some years they just wanted bullet points of topics, you know, so it all depends on your institution's IRB. So you need to find out what it is that they expect. It's sticky with qualitative research because since to do rigorous research, you don't need to stick with a poorly worded question. It'd be a shame to do it. So talk to your IRB and say, I'm not going to change the nature of the question. I'm just going to change the wording so it doesn't sound so stilted, or, you know. But it's kind of a touchy issue, IRBs. And so my advice would be to get a good relationship with your IRB and work with them to figure out what's the best way to get the research done within the requirements of the IRB. Yeah. So what's an open-ended question?
Do you ever try to sort of gauge how much happy memory is involved in recall of these things? Like if you ask people what they typically eat for dinner, they might, start recalling that, okay, well, I eat vegetables and maybe some potatoes and meat, and forget to mention that they have a can of Coke with every meal.
If that's what you want to know, then that's what you do.
Would you ever try to make it okay to say, I really enjoy a can of Coke with dinner. Do you as well?
Oh, well, you try not to lead the person, but usually what I do is, I did actually a study of sugary beverages, in fact, and, first you start off saying, what do you like to drink? And then they mention tea, water, and then you say, well, what else? What about on a hot day, you just finished playing basketball or something, and so you keep, I don't think I'd ever go as far as say, I really enjoy a can of Coke, because it's normalizing in kind of a false way, but what I like to do is you start really open-ended to see what is generated from the person, and then if they're not even touching the topic that you really want them to comment on, then you ask about it, after. Like when I did a study of the different, screenings, and I would say, well, what test do you use to look for, have you ever had a test for cervical cancer? And then to a person, almost every woman said no, which I didn't really believe. But then I was thinking, I don't think that they're denying that they've had a PAP. I think they don't realize it. So then after we go through all of that, then I say, so do you ever have a pap smear? Oh, yeah, sure, I get one every year. So I didn't say it in the beginning. So what I learned from that is that they are getting PAPs and they're not really sure what it's for. So you learn a lot that way. But if I had just started with the PAP, or said, well, I get PAPs, do you get PAPs? Like, I don't know, it's a little, I wouldn't go there. I probably wouldn't do that. So, but the idea is to be really open-ended. So you want to say, so instead of saying, do you eat vegetables as part of your dinner, you would say, what do you typically eat for dinner? And then come back in and say, so what about vegetables? So what about drinks? What do you, like that kind of thing, put it together. Or how would you rate your experience at your doctor's office today? The person might say, well, it's okay. Which, or is very good, which is fine if you're doing a survey, but don't you want to know more? Don't you want to know what was good about it and why was it good, and is it always good like this, or is it different than it was last time? And do you expect it to be this good next time? Or was there a particularly nice medical student there today? What made you feel better? Like what was it? So then you would say, so tell me about your doctor's, how your doctor's visit went today. And you would start getting all of that. And then if she's not bringing up the particular thing you want to know, like what is the impact of having a medical student in the room, then you ask about that kind of thing. So there's, I can see I'm not going to really be able to get through too much, but there's 4 kinds of individual interviews that we find to be very, very useful in clinical and public health research. And I will go through each of them very briefly because I think you would use all of them one way or another. In-depth interviews are just what they are. They can be on any topic, whatever it is you're studying, but you want to explore the topic in detail with the follow-ups and the probes that I've been alluding to. And you want to know what's going on in people's own words with the structure and the flexibility that I've described. And so that's what you do. And there isn't any particular other way. Some people call them depth interviews. Some people call them in-depth interviews. Some people erroneously call them cognitive interviews. Don't do that, because cognitive interviews are something else, which I'll tell you about in a minute. But any kind of just basic open-ended interview, you can call it an in-depth interview. Another kind that I have used a lot in my studies here with people in the School of Public Health is a specific kind of in-depth interview that you look backwards and you look forwards in time. And being diachronic can be extremely helpful because understanding what somebody is doing or thinking now may not be as informative to you as understanding how she's come to make that change and whether she's planning on keeping it in that direction. So you look backwards and you look forward. And you still use, the spontaneous probes and all the regular techniques, but you go backwards and forwards. So as an example, if you're interested in parents' attitudes regarding their obese child's weight, let's say. So instead of, harping on them right now, so what are you feeding this child and what is this child drinking and does this child, what kind of exercise is this child? Instead of, just focusing on that where you don't really know, did they just move to a new neighborhood? So now they're going to the park, but actually until 3 months ago, they never did. Or grandma moved in, and since grandma's cooking, now, the food is different than it was before. These are the kind of things that you could imagine would be very, very helpful. So you want to know, I think, you usually want to know, how are things different now than they were maybe in the immediate past and, a little bit further, whatever makes sense for your study. So you want to know maybe also what they were thinking and doing in previous years, what they thought and did regarding their other children, what were the attitudes and behaviors regarding children's food and activity when they were growing up themselves, and so on. All of this can broaden your contextual understanding of what's going on. So that's what's nice about life history interviews. Key informant interviews are basically, they're kind of different because your interview might be a little bit different with each person. Like let's say you've got 10 or 12 key informant interviews before you start doing the rest of your study, because these are people who know something about your topic in a different way than you do. So some patients could be key informant interviews, but it could be, let's say you're looking at domestic violence and you're a physician. So you know everything that you know from a physician's perspective. So maybe you also want to talk to community advocates, against domestic violence, community-based counselors and social workers and mental health professionals. shelter staff, police, lawyers, academics who have studied this from the patients or the victims' perspectives, patients, other ways. So these are people who can broaden your understanding of a topic. And what they might help you do is actually change your research question, because you might be thinking of it this way, and you talk to people who know more about, say, the victim's experience, and suddenly you realize, hold on, this is narrow, this has been done before anyway. I want to actually look at it this way. And so that's what's nice about key informants. So we call them insiders, outsiders, because they're inside. They have an insider knowledge of one way or another, but they're outside enough that they can explain to you what's going on in the context that makes sense to you from a scientific perspective. So they're usually a little bit different than the people who are going to be the participants in your study. They might be community people, they might be professionals, but they can communicate sort of across that boundary of research. So it's very helpful.
I think you're one slide behind. Are you on?
Oh, am I? Sorry. Okay. So cognitive interviewing. So cognitive interviewing comes, it actually comes out of police work for getting people to remember. It's sort of like what you were talking about, to get people to really remember what they were doing or what they saw in some kind of crime. But it's used in public health and I suppose, for clinical research too, to help people understand how their survey questions are being received by the participants. So you do it to test your survey questions, and I can't go into all the details of how, but basically you have people either in a group or individually who will tell you what they're thinking as they look at the questions. And that is an eye-opener, let me tell you, because you think your questions are crystal clear, but you know what your study is about. You know what your question is supposed to mean. So you find out from people who are just like your participants to be what people are thinking. So they read the question, they answer the question, or you read it to them, in whatever modality you're going to be administering this survey, and then you ask them, why did you choose that answer? What were you thinking about when you chose that answer? Or you hesitated, was that because you were confused, or is there something that you didn't understand? And you do this, it's very tedious, but you do this with every single question. And I've been through this where we've sent a cadre of research assistants, into maybe a community center, and people file in, and we just keep doing the survey over and over and over with all of these probes and asking them. And then we find out which questions really are kind of problematic because people think they mean something else. And there was an anthropologist that once said, you only know the meaning to the answer of the meaning of the answer to your question until you know what question was being answered. And in surveys, sometimes you really can't be sure that you know what questions people are answering. So it's worthwhile doing this kind of technique, and it's used very, very widely in health and medicine. So focus groups, very quickly. There's great primers out there on focus groups. You can Google it. You can, they're easy to understand and kind of difficult to do. So group facilitation, and you would want to use focus groups only and if what you're looking for is to elicit the dynamic interaction among participants. If you want in-depth, uninterrupted stories of people's experiences on the topic that you're studying, you want to do individual interviews. Because in focus groups, you just get snippets. It's very superficial. But what you do get is that interaction. You can also get bias because somebody says something, somebody else decides they want to agree. But with the skill of facilitation, you can keep cutting through that. You can keep undercutting when you see that happening and asking people different questions in different ways and moving them through the topic and circling back. And, it takes a lot of facilitation to do it, especially if you have a noisy group or a very talkative group, but mostly because you want to get at those issues of, let me try to get at as honest opinions as possible. Usually 8 to 10 people. I've had focus groups with more, I've had focus groups with less, but that's considered the ideal. You want to select the participants carefully because you don't want people to be upset by other people in the group necessarily, so you wouldn't necessarily have physicians and CNAs in a practice in the same focus group because They may not be as open as they might if they weren't together. You, of course, audio record it, usually have that transcribed. You definitely want a script, but you want to know that thing backwards and forwards. You want to have practiced that in the mirror and with your friends ad nauseum, because people will be continuously bringing up question 13 when you're only up to question 3, and if the flow is good, you want to go with it. So you move your way through everybody's story, and in the end, usually what you do is an analysis of the group as a whole, not so much, the individuals, because you're not really sure who said what. But it can be very, 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 very good data if done well. And focus groups are usually only as good as your recruitment techniques. So that's the short version of focus groups. Other methods, now these days with the internet, there's all kinds of things that people do. Obviously, people have done analyses of TV ads for junk food and the impact on kids, eating behaviors. And so there's all kinds of things that have nothing to do with live human beings that can have qualitative content analysis applied to them. So advertisements, somebody I work with did a study of tobacco company documents, analysis of comparative state-level texts of health-related legislation. You could look at web page content. You could look at discussion forum content, blog content, you name it. And the other that is used, actually there's a term now in the literature you can look in PubMed under something called photo voice. And something that I did actually back in Peru all those years ago was give cameras to people and have them document their lives. And people have done that recently for people to document, for instance, their life in pain and see what they take photographs of, and then you print those out, and then you have them explain the photographs. Or take videos. There's all kinds of very, very, very creative and interesting ways to get at, again, other ways of knowing, and for people to bring the social context of their health problem, whatever it is you're studying, into more vivid detail for you. And there's great articles on these things, and actually, if anybody wants to get in touch with me, email me or something, I'd be happy to talk to you more about any of these methods. So kind of in summary, the uses of qualitative research are formative research in the very beginning of your study, to really find out what's going on in a community or in an area where you don't know very much about the topic. Process tracking, to try to figure out, so I'm doing an intervention. How are people experiencing this intervention? I'm noticing a lot of people aren't showing up on certain days. What's going on? So you might want to do some process tracking to see what's going on, or outcome evaluation. We did a study. I did a study here with people at the School of Public Health of fruit and vegetable and physical activity behaviors in small businesses. And so at the end of this very long intervention in many small businesses, we did qualitative interviews with people who participated a lot in the study and people who hardly participated at all, to find out what was different about them. Not that we could statistically look at that, but to try to, get some trends and understand, and also to find out why they didn't participate very much, or why they did decide to participate a lot. So it's useful at all different levels of the study. You can obtain data that's useful on their own. Sometimes the qualitative research that we do in the beginning of a study generates the first papers of a very, very large study, because the data does stand on its own. And it was also used to help design the surveys, to help design the interventions and the intervention material. So it's very, very multi-use once you get that data. Also, you might want to use it as building blocks, as I just mentioned, to help you figure out what are the best responses to put in my survey, because I don't know what people are drinking here. So if I get them to talk about it, then I'll have a better idea what the closed-ended responses should be on the survey. Or cognitive interviewing to test the surveys, or to complement, or maybe even explain. Sometimes we do qualitative interviews at the end to help explain the statistical results that we got, like to try to get a sense of maybe why a certain result was found. So let me super quickly give you 3 examples, and you can mostly see what the different methods were, there on the slide. So the health promotion among unionized construction laborers that I've talked a little bit about already, the formative research wasn't all qualitative. Sometimes it's both qualitative and quantitative. So we did, a cross-sectional telephone survey with 1,100 people around the country. We did focus groups in 4 regions of the country for 16 focus groups. And then we did participant observation on the construction sites. So that was a really, really nice way to get a very good sense of what was going on before we designed the intervention and the materials. And just to give you an example of how did we use this information. So we, for the intervention materials, we figured out from all of this formative research how we would engage the laborers in this union in this study, how we would get them to open the invitation letter and to read it, because there were so many warnings that people wouldn't open the letters coming from us. So should it come from us? Should it come from the union? Should it have the union logo on it? Should it have the president of the national union's picture on it? Or should it have all the local union presidents around the country? Actually, the answer was the latter. And what are the symbols that people in this union resonate with? What are symbols that we should make sure to stay away from? What topics would catch their interest that we could use as a hook? And on and on and on and on. All of this came from the formative research because a similar study hadn't been done before, and we really didn't have the answers to figure out where to start designing from. So a study that I did in Providence, called Hablemos de Ti, Let's Talk About You, was about the menopausal transition among Latino women, mixed Latino women in Providence. And I did a series of focus groups with women in different parts of Providence and from different countries. And it was looking at their perspectives on the social, cultural, and the physical elements of the menopausal transition. And then the women wanted to keep getting together so much, and they kept showing up on nights that I wasn't at the community center to hold focus groups. So I coined a new term, reunion focus groups, and I had a whole other set of focus groups that were open to anybody in any focus group who had ever come before. And so then we had continued discussions, and then we also did individual interviews with a different set of women to try to get more information in depth. And sometimes what we do is we pick people out of the focus groups in order to interview them in depth, or we can interview other people, because you want to get both. The dynamic was great, but we were missing some of the richness of the story. And then I also designed an interactive internet intervention, which women participated in, and further information and data for qualitative analysis was the content of the postings. So that was multi-method qualitative. And then I won't go much into it, but you can see in a study that we did here of cancer risk in low-income housing, we used all of these different methods for the study. And then it's not so much that we analyze them together, but we analyze them in respect to each other to try to understand the problem from all different sides. So that is the end of my talk, and I don't know if there's time for any questions. Sure. Are there any questions that anybody has on any of the topics I brought up? Okay. So.
I have a comment. Go ahead. Well, let me say that I think that my perspective has been on this entire topic that at the School of Public Health, we're so oriented toward quantitative thinking that one can have the illusion that research is quantitative research. But then as I've begun to appreciate more the significance of qualitative research, I've realized that one can't do quantitative research until you have well-formulated questions. And those well-formulated questions really fall in the domain of qualitative research. So every quantitative investigation that we do has been preceded by open-ended analytical work, whether it's in the laboratory, whether it's in the community, to form an understanding of the question sufficient to construct the quantitative investigation that we're doing. So in a very fundamental way, qualitative research is really the foundation of science. So that would be my comment on this topic.
Thank you.
So, Roberta, thank you. I'd like to get a free consultation from you here. And that is, NIH spends a lot of money to fund the clinical translational science centers. And as part of the requirement when you submit a grant, which Harvard did and has the Catalyst grant, of course, is some form of evaluation as to whether or not what you're doing is working. So from our perspective in postgraduate education, we are very interested in trying to understand whether the kinds of educational experiences that we offer, or the range of courses that we have, and whatever other creative things we try and do are actually helping. So have you had any experience in trying to assess something like that, and advice that you might have for how we would make a judgment about whether we're heading in the right direction with the kinds of courses we put together?
Yeah, well, it's actually interesting because being, with my Brown appointment, being in the School of Medicine and being in the Department of Family Medicine, we do a lot of educational research. So that's what we're doing, is evaluating educational innovations on a continuous basis. And it helps, it does. What we like to do is usually multi-method. We might do some surveys and things, but what I like to do is interview people from all spectrums. So we're doing some innovations in trying to get family medicine residents to do more scholarly work. And so we've implemented those things, but we're interviewing the faculty who are teaching, the faculty who serve as mentors for the scholarly projects, the faculty who precept in the clinic to see whether they, how they feel about mentoring and fostering research questions. And we're interviewing all of the learners who are going through at different stages of learning to understand. And we've compared them to learners who were third-year residents before we started the program. So that's my advice, really, is get people from all angles, because I want to know, does the faculty feel prepared to mentor the projects? We've just said every project needs a mentor. Great. But, how do the faculty feel about that? And how do the residents feel about asking? So I can certainly go more in depth at another time, but I think really covering the range of participants is important. Yeah.
So a lot of the lectures focused on adults. I'm wondering if you have any insight into doing research in children,
Mm-hmm.
and qualitative research in children, and what the challenges might be,
Mm-hmm.
and your recommendations would be if you wanted to.
Yeah, well, I guess a lot of what you might run into would be ethical and IRB issues. So it really depends on what your topic is. Whether it's appropriate to be talking, open-endedly with children about a certain topic. One consideration, which would be the same with any kind of research, is you need a different kind of consent. So when I did the study of inner city dwelling youth about risk for substance use, I needed to get a consent from their parents and an assent from them. And you do get into, sort of the immaturity factor of talking to kids, especially if you're doing focus groups. You probably have a better chance of getting a good story individually with kids. But you might have a research question that would benefit from the dynamic interaction. So do both, in that sense. But, kids' attention spans and, some people, that whole issue of out of the mouths of babes, maybe you get more truthful story from kids about what they're really eating at home or what's really going on than you might from their parents. So, but you don't know, how prepped they were by the parents before. So I think that there's dozens and dozens of considerations in doing qualitative research with kids. It really depends on your project, in terms of, but people do, the experience of cancer treatment, and there's tons of studies that are out there, with pediatric populations, but you just want to make sure you're doing it in the way that makes good sense, and maybe also, and this is a funny thing about qualitative research, maybe also if you're the right person to do it, not just with kids, but all around, do you have the patience to let someone tell you the story without interrupting a lot? Do you, do you have the personality to put people at ease? Some people, frankly, probably aren't cut out for doing their own interviews or their own focus groups. And so it doesn't mean you can't use that, but collaborate with someone who might do it, you know. So I can see a lot of issues with pediatrics, which probably aren't all that different than with adult populations, but they manifest themselves differently with overall. Unless I don't know if there's something specific you were thinking of that.
Well, I think we're out of time.
Yeah.
I could chat with you offline.
Yeah. Okay. Was there one more question?